ACOM.
ACOM is a global design consultancy and engineering professional services firm. Largely, we are the designers of all the major projects that you see around Victoria and across Australia. Over the last couple of years, we've implemented an integrated wellbeing model into our business.
I've really noticed the culture at ACOM shift since the strategy was introduced in 2018. Before, people, and myself included, might have been unsure about talking about mental health issues. Now it's almost an everyday occurrence.
We've brought in a new wellbeing and psychosocial risk management critical risk framework and a new procedure. Part of that procedure is having some critical controls in place, things like making sure that resourcing is appropriate for our people. We take a go, no-go approach, the same as a safety stop work approach. We apply that to wellbeing for people to put their hand up and say, I don't have the resources that I need to perform my work. In terms of our other programs, our 5 Ways to Wellbeing, our Wellbeing Champions Network and our Mental Health First Aiders Network is really well known throughout our business as well.
In addition to being an engineer with ACOM, I'm also a trained mental health first aider. We act just like a physical health first aider, but this extends to the mental health sphere. So we provide confidential initial peer support to our colleagues.
I'd feel really comfortable talking to someone at the organisation if I felt I needed support. I have in the past, to be honest. There's been times when I've told my direct manager that I'm not feeling great and feel like I'm not able to do work effectively, and I don't feel there's any stigma or any shame attached with it.
This is only the start of our journey on a cultural change or shift when it comes to wellbeing. What we're seeing is that people are more willing to put their hand up and saying, I need some help, and they're seeing some response from our senior leaders to say, we're hearing you, we're listening, and we want to help you.
Level Crossing Removal Project.
We're Level Crossing Removal Project, and the health, safety and wellbeing initiative we've created is the Lead Safe program. Lead Safe was created because we know in construction that we're not there yet in closing that gap on injuries and fatalities. And you couple that with the mental health challenges that our people are experiencing in an industry where there's very high work demands, and we know we needed to do something different. The goal of Lead Safe is for everyone to be safe and well everywhere, every day. Lead Safe's innovative because when we began this project, we asked our people what did they believe we all needed to do if everyone was to be safe and well. What they came up with were 5 behaviours, and because they came up with what they thought the behaviours were, everyone has been bought into it right from the very beginning.
I'm extremely proud to work for an organisation that is fostering those 5 behaviours. I think that positive safety culture, particularly the importance of my mental health, that's a huge learning from this program that has helped me grow as an individual, but also my team members and our contractor on site and all parts of the business.
The Lead Safe program really does advocate for people to speak up, ask the question and listen, and we also have a really safe space to do that. Our leadership team is really supportive.
When you have visible leadership commitment to something, it grows from there.
Lead Safe gives me the tools as a manager to connect with my team, whether it's chat cards to encourage safety and wellbeing conversations or thank you cards to show gratitude to staff. Myself and other staff members are very comfortable having discussions about mental health and wellbeing. It's much more just part of the general conversation.
The idea behind Lead Safe is completely transferable to any organisation. It really is about knowing your people, getting to know what their needs are, and developing a program that's able to grow and evolve with you.
The 5 Lead Safe behaviours I'll be taking with me to the next organisation I work at. It's embedded in my DNA now, and I'm very grateful for that.
Western Health.
My name's Elisa Relata. I'm the Project Manager for Occupational Violence and Safe Wards at Western Health. I think we spent quite a bit of time looking at incident data from staff. So what came out in the data was that staff were putting themselves at harm's way to protect patients. It is normalised, unfortunately, and it is part of the culture. So the initiative is called Predict, Prevent, Priority Safety. The whole campaign is around preventing the mental health injury that comes from occupational violence.
The initiative is a series of tools, posters, videos and other awareness material, as well as some clinical tools that are utilised across our health service.
Support from the organisation has been incredible from the top down. So we've had a strong message also from the CEO saying, I'm asking you to do this. I'm asking you to prioritise your safety. So that's been a really powerful message.
I've worked here for 25 years, so the message was not like that when I started. I feel that the message is a lot clearer, that we have the support, which is really important.
When I first commenced at Western Health, we had significant numbers of code grey events, which are events where security are required urgently due to occupational violence and aggression. Since the implementation of this program, the incidence of reactive code grey events has significantly decreased, and that has been replaced by planned code grey events where security and the clinical team are putting a plan in place ahead of an incident occurring to try and prevent that incident occurring in the first place.
I hope that these key messages could be promoted in any healthcare service, because there's just such a need for these messages to be promoted more widely than just Western Health.